Good morning to all. I would like to adopt the protocol that has already been established. And I would really like to thank the organizers for the opportunity to participate in this forum of research and innovation, which really forms the foundation of medicine and public health. At the United Nations Millennium Summit in 2000, governments of over 189 countries agreed upon the adopted United Nations Millennium Declaration that highlighted the 8 time-bound targets with a deadline of 2015, known as the Millennium Development Goals, with the main aim of improving the lives of the world's poorest people by 2015. But based on the successes achieved and the challenges faced up until the deadline of 2015, many nations believe that the world can still be a better place and set a new deadline of 2030. Governments agreed that the global goals for sustainable development will provide that critical pathway to achieve an eco-friendly and better world, so new goals were set. St. Lucia is among the list of countries working steadfastly towards meeting the 17 United Nations Sustainable Development Goals so that the citizens can have good health and well-being, experience gender equality, enjoy the basic right to clean water, sanitation, bring an end to poverty, facilitate industry, innovation, and infrastructure, among others. Research and innovation are 2 key activities that are vital to the attainment of the 17 United Nations Sustainable Development Goals. We need to look at the indicators, collect and analyze data to enable us to reach the expected targets for each of the Sustainable Development Goals in the various sectors. As advocated by the organization, Social Progress Imperative, I agree that our focus should be on life outcomes and social progress of our citizens and country, as this will bring us closer to meeting that benchmark for sustainability. Michael Green, the CEO of Social Progress Imperative, has advocated 3 overarching areas that should be paid particular attention to if we are to drive social progress to eventually achieve sustainable development. Researchers and innovators should focus their studies on the first one, basic human needs, which comprise of nutrition and basic medical care, water and sanitation, shelter and personal safety. The second one, the foundations of well-being, which speak of education, information and communication, health and wellness, and sustainable environment. The third one is the opportunity for citizens to improve themselves by having their rights respected, be free to make choices, and to be free from discrimination. Traditionally, research and innovation has really formed the foundation of medicine. This COVID-19 pandemic has affected the world beyond anyone's imagination, not only health-wise, but socially and financially, setting the stage for the conduct of a plethora of research and the creation of innovative technologies to help combat the virus and improve the outcome of our lives. Regionally, there are calls for healthcare providers and professionals of all spheres to conduct research and submit abstracts on COVID-19 related issues. Our frontline workers and public health practitioners have been seeing trends and taking note of how COVID-19 situation is impacting on the public and our healthcare and social systems in a similar way that we've seen the effect of Zika, chikungunya as new public health threats, dengue fever as one of our endemic diseases. Many countries are seeing the need for research and innovation, and St. Lucia will be a contributor to the global research pool as our people progress in seeking to conduct research guided by the Health Practitioners Act here, a legal instrument that calls for all research to be conducted in an ethical manner. It is imperative that public health recommendations be guided by evidence-based research, guided by the science for effective results, especially in resource-limited settings, such as here in St. Lucia. All research involving human participants, human tissue, human data must be reviewed by the legally constituted Research Ethics Committee of the Medical and Dental Council here in St. Lucia. Innovative technologies in communication and information, food production, and now virtual education learning are becoming more sought after during this pandemic. Our children are engaged in e-learning and becoming more technologically savvy. With structured and planned research and innovation activities, focusing on what we hold dear as our basic needs, opportunities that will improve our lives and have us in a state of well-being, we'll be well on our way to achieving the 17 United Nations Sustainable Development Goals. Thank you.